Ovarian cancer. It's a phrase that strikes fear into many. Often called the silent killer, it can be difficult to detect in its early stages. But knowledge is power. By understanding the warning signs, risk factors, and the importance of early detection, we can fight back against this disease. The ovaries are part of a woman's reproductive system. They are small, almond-shaped organs that produce eggs and hormones. Ovarian cancer occurs when abnormal cells in the ovary begin to multiply uncontrollably, forming a tumor. If left untreated, this tumor can spread to other parts of the body. One of the trickiest aspects of ovarian cancer is that the symptoms are often vague and can be easily overlooked. This makes it incredibly important to pay close attention to what your body is telling you. These symptoms can often mimic other, less serious conditions, which can lead to delays in diagnosis and treatment. It's easy to dismiss these signs as something minor, but being vigilant can make all the difference. However, it's crucial to be aware of any changes in your body and to see your doctor if you experience any of the following: abdominal bloating or swelling, which can often be mistaken for simple digestive issues. Feeling full quickly after eating, even when you haven't had much, can be another red flag. Unexplained weight loss, which might seem like a positive change, can actually be a sign of something more serious. Pelvic or abdominal pain that doesn't go away should never be ignored. Frequent urination or changes in bowel habits like constipation or diarrhea can also be indicators. These symptoms might seem unrelated, but together they can paint a clearer picture of your health. Always consult with your healthcare provider if you notice any of these signs. Early detection can save lives. Risk factors. Understanding your odds. In this section, we will delve into the various factors that can influence your likelihood of developing ovarian cancer. By understanding these risk factors, you can take proactive steps in managing your health and seeking early intervention if necessary. While the exact causes of ovarian cancer are unknown, there are certain factors that can increase a woman's risk of developing the disease. It's important to be aware of these factors so you can discuss them with your healthcare provider and make informed decisions about your health. These include age, as ovarian cancer is more common in older women, particularly after menopause. The risk increases significantly for women over the age of 50. Regular checkups and being vigilant about any unusual symptoms can be crucial in early detection. Family history. Having a close relative with ovarian cancer increases your risk. If your mother, sister, or daughter has been diagnosed with ovarian cancer, your risk is higher. It's also important to consider the history of other cancers in your family, such as breast cancer, as they can be linked. Genetic mutations. Certain gene mutations such as BRCA1 and BRCA2 are linked to a higher risk. Women with these mutations have a significantly increased risk of developing ovarian cancer. Genetic testing can help identify these mutations, allowing for more personalized and proactive healthcare strategies. Reproductive history. Never having given birth or having your first child after age 35 can increase risk. Additionally, factors such as infertility and the use of fertility treatments may also play a role. Discussing your reproductive history with your doctor can help in understanding your individual risk. And endometriosis. This condition, where uterine tissue grows outside the uterus, is a risk factor. Women with endometriosis often experience chronic pain and other symptoms, and this condition has been linked to an increased risk of ovarian cancer. Managing endometriosis effectively and monitoring for any changes in symptoms is important. While these risk factors can seem daunting, there are steps you can take to reduce your risk. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and stress management, can have a positive impact on your overall health and potentially lower your risk of ovarian cancer. Regular screenings and checkups with your healthcare provider are essential. Early detection is key in the successful treatment of ovarian cancer. If you have any concerns or notice any unusual symptoms, don't hesitate to seek medical advice. Support and education are also crucial. Joining support groups and staying informed about the latest research and advancements in ovarian cancer can empower you and provide a sense of community. Remember, you are not alone in this journey. Understanding your odds and taking proactive steps can make a significant difference. By being informed and vigilant, you can take control of your health and improve your chances of early detection and successful treatment. Stay proactive, stay informed, and take charge of your health. Section 5. Early detection, your best defense. Early detection is key when it comes to ovarian cancer. When found and treated in its early stages, the survival rate is much higher. While there is no single test to definitively diagnose ovarian cancer, a combination of pelvic exams, transvaginal ultrasounds, and blood tests can help identify potential problems. Final thoughts. Join the fight against ovarian cancer. Ovarian cancer is a serious and often deadly disease that affects thousands of women each year. It is crucial that we come together as a community to raise awareness and support those who are battling this illness. Ovarian cancer can be a devastating disease, but we don't have to face it alone. There are numerous support groups and resources available for patients and their families. These groups provide emotional support, information, and a sense of community for those affected by ovarian cancer. By raising awareness, supporting research, and advocating for better screening methods, we can make a difference. Fundraising events such as walks and runs are essential in generating the necessary funds for research. Researchers are working tirelessly to find better treatments and, ultimately, a cure for ovarian cancer. Talk to your doctor about your risk factors, be vigilant about your health, and encourage the women in your life to do the same. Early detection is key in the fight against ovarian cancer. Regular checkups and being aware of the symptoms can significantly improve the chances of successful treatment. Together, we can fight for a future free from ovarian cancer. By joining forces, we can create a world where ovarian cancer is no longer a threat. Let's stand united, support one another, and work towards a brighter, healthier future for all women.